So welcome to our aspiring psychological professionals community of practice today, where our focus is CBT therapists and high intensity training, working with adults with common mental health problems. We're really excited to see you today. Thank you for joining us. I'm just going to introduce you to the PPN, the Psychological Professions Network team. So I'm Maggie Rosario and I'm chair of the East of England Psychological Professions Network. We're also joined today by Emily and Fumi, and they're going to be monitoring the chat, letting people in. So meeting practicalities, we're recording the meeting. If you could please keep your microphone on mute and your cameras off if you're not presenting. We want this to be a safe space that's confidential and respectful and non-judgmental and not pressured. It's a supportive space. Please ask your questions, but in the chat. So please don't raise your hands or turn on your camera. That helps us with the recordings. Please just use the chat. Post any questions there. We might not get around to all of the questions, but we will do our very best. And please share your feedback with us at the end. It really makes a difference and helps shape what we do. So please do tell us what you think of this event. This is our agenda for this evening. We have welcome and introductions, which we've already done. Then we're lucky enough to have Gareth with us. He's a high intensity therapist. He's going to be talking about the CBT therapist high intensity worker role. He does it every day. Then we've got Camden and Louise from our regional course teams, and they're going to be talking about the training that you need to undertake if you want to be a high intensity CBT therapist. Then we've got Lynn, who's a current trainee, and she's going to be talking about the role of a trainee. Then we're going to think all together about routes into training, the qualities that make a good CBT therapist or trainee, and also what's helpful to know before embarking on the training. Then there'll be a chance for you to ask your questions, and then we're going to look ahead to the next meeting and a Southwest event that's happening that you might be interested in. And then we're going to close. So that's what we're going to be doing. So if we could turn to Gareth. And you're here to talk about the CBT therapist high intensity worker role. Are you here, Gareth?
Yes, I am. Yeah. Hi.
Oh, it's
Hi,
so
everybody.
great to see you.
I have my presentation open, so I'll hopefully you'll see that shortly.
Fantastic.
I'll just share this with you now.
Thank you. Brilliant. That's great.
Wonderful. So as Maggie mentioned a few moments ago, I wanted to spend a little bit of time, a few minutes, introducing you to the CBT high intensity therapist role. I am employed as a full-time high intensity therapist within the NHS Talking Therapies service. So I'll just, sorry, bear with me a second. So this evening I wanted to cover 3 points. First of all, to give you all of a very brief introduction to the CBT model and CBT theory. Then I wanted to move on and describe or provide some examples of the mental health conditions that we treat as high intensity therapists. And then finally to talk a little about the high intensity therapist role itself and some of the day-to-day activities and responsibilities that come with that. So to begin with, as I mentioned, I thought it would be helpful to give a very brief review of the CBT model. And I think the British Association for Behavioural and Cognitive Psychotherapies, or the BABCP, summarised this quite nicely. As you can see on my screen, CBT is based on the theory that our thoughts, feelings, what we do, and how our body feels are all interconnected. And if we can make a change to one of these, then we can alter all of the others. So, for example, when we are feeling low or anxious, we sometimes engage in patterns of thinking and behaving, which can worsen how we feel. But CBT can help us to notice and change any problematic thinking styles and behavior patterns to help us to feel better. And CBT is a collaborative form of therapy in which an individual and a therapist work together in order to help the patient to achieve mutually agreed goals. And then moving on to my next slide, some examples of common mental health conditions that are treated by high intensity therapists include depression, generalized anxiety disorder, so where a person experiences worry in relation to a number of events or activities and finds it difficult to manage that worry. Social anxiety, where a person experiences fear or anxiety in relation to at least one social situation in which the person fears that they may be exposed to scrutiny by others. Obsessive compulsive disorder, where a person experiences intrusive thoughts which are often worrying or distressing in nature, and they may try to suppress or neutralize those thoughts by engaging in related behaviors which over time can become time and consuming and cause distress. A panic disorder, in which a person may experience physical symptoms of anxiety or symptoms of panic, such as heart palpitations, and that may lead to them worrying about having additional panic attacks or what the consequence of those symptoms might be. Post-traumatic stress disorder, in which a person may experience symptoms of trauma such as flashbacks and nightmares, for example, in relation to an event that they've experienced or witnessed. Health anxiety, in which a person may worry about their health, or again may worry about possibly a physical symptom being an indication of something sinister. And also CBT can help in the treatment of specific phobias. So some examples might be agoraphobia, a fear of needles. CBT can help in the treatment of a wide variety of phobias. And as noted at the bottom of this slide, the National Institute for Health and Clinical Excellence, or NICE, recognises CBT as an evidence-based effective treatment for all of these conditions, but also some other conditions as well. And then on my final slide, I wanted to give you a very brief overview of the high intensity therapist role and the responsibilities that come with that. So I've noted some of the day-to-day activities in which we engage would be to help with the assessment of new patients, to establish the nature of any mental health difficulties and their suitability for high intensity therapy. My main role as a high intensity therapist would be to, or is to deliver CBT interventions based on NICE guidelines to patients with moderate to severe common mental health conditions, such as those outlined on the previous slide. As a therapist, we often engage in CPD activities, such as attending conferences, the completion of courses or self-directed study, to keep up to date with the latest psychological developments, and also to aid to develop our knowledge as clinicians. One of the one of the things that I enjoy personally the most about being a therapist is that opportunity to continually develop our skills, and the opportunities that that can present. So since completing my training a few years ago, I've had the opportunity to specialise in the treatment of long-term health conditions and the impact that those can have on our mental health. I also recently became a supervisor in the service in which I currently work. So those CPD activities are very enjoyable and can lead to some amazing opportunities in my experience. In our roles as therapists, we always attend supervision, again to aid skills development and to ensure the best possible outcomes for our patients. We do sometimes signpost or refer patients to other support services, depending on the nature and complexity of their presentations. As part of our role, again, as a therapist, it's important that we keep coherent records of all our clinical activities. And finally, to ensure that we comply with any relevant legislation and service protocols. That would be a brief description of the therapist role in my own experience. So I hope that was helpful. I hope that gave you a very brief introduction to the CBT role and the type of work that we do. And please do raise any questions towards the end of today's conference if you would like to. And I'll just stop sharing that with you now.
Thank you very much, Gareth. I think that gave us a lovely overview, and you'll be part of our question answering shortly, won't you? Which will be great.
Yes.
And there are already starting to be some great questions in the chat.
Fantastic.
So thank you. Thank you. So now we're going to hand over to our course representatives, Louise and Kandan. Thank you so much. Would you like to share your screen with slides, or would you like us to share it here?
You've got my slides open here that I can share. I think these are just coming up now.
Brilliant, super.
Hopefully you can see those, or will do soon.
Okay. Thank you, Louise. Hi. Shall we introduce ourselves first?
Yeah.
Yes, let's start with you, Louise, and then I'll carry on. Yeah.
Lovely. Thank you. So, evening, everybody. My name's Louise Crouch-Reed. I am the Programme Director for our High Intensity Training course at the University of East Anglia in Norfolk.
Good evening again, everyone, and I am Kandan Ertebey-Sterling, and I'm the course director at the University of Hertfordshire in Hatfield. And now what we would like to do today to take you through several slides to explain how the cognitive behavioral therapy courses are established in the country in the light of BABCP regulations, which is our regulatory body for practicing cognitive behavioral therapy. We have several slides. Those are basically start with training structure, moving on to entry requirements, and then also looking at other characteristics which might be useful for you to know. And later on, we'll finish off with touching upon cases of international students and pay structure if you happen to be working in NHS at the end of your training. I'll present some of the slides, and then my Louise will take over and continue with the remaining. First of all, this is level 7 qualification, so it's a master level. But you could do, typically, people take the CBT training, they do either postgraduate diploma or MSc. And postgraduate diploma usually are sufficient for you to start practicing as CBT therapist if you successfully complete the course. But there are options of master where some people take that avenue for furthering their studies. This PG diploma or master deliver across number of modules in totaling to 120 credit for postgraduate diploma, 180 credit for master, which is exactly the same as any other structure of masters and postgraduate diplomas. In terms of clinical supervision, we offer that part of the training, and there is a minimum requirements of 40 hours of supervision, which is required by BABCP. Each courses support that clinical supervision part of their training structure. If you are employed in an NHS-funded role, you will be given clinical work each week in your organization where you the NHS funded placement, usually early intervention services, talking therapies. But there are other routes available in order to get in and to do CBT training. And if you require, we will expand on that later on. Training covers fundamental of CBT and treating anxiety disorder and depression, as well as training on working with diverse groups and providing high quality, effective, evidence-based treatment to all. As colleague Garrett Wood has explained at the beginning, this training is specifically focusing on presentations on depression and number of variety of anxiety disorders, which we named. Depending on the qualification, there may be a research component that usually happen if you chosen to complete a master degree. But on the whole, training has got research evidence-based practice. Effectively, every protocol and treatment method you will learn based on evidences which has been established over the years. Louise, shall we move to the next one? Thank you. In terms of entry requirements, there are quite a few things you need to be achieving to that point. One of which is the first requirement, we would say, your background and significant experience on working in health or social care, and having a degree or equivalent level of academic achievements. People with typically people with psychology, nursing and social care degrees or any other health allied degrees are usually eligible for entry. Then there are further requirements. These are people training in CBT will already have an understanding of research and theories of human development, human problem and distress, as well as social context, all of which need to be documented, which we will explain you a little bit later when we describe you one of the entry criteria, which we call it KSA. In order to entry to CBT training, BCP recognized number of core professions or the past experiences and degrees which will accumulate to minimum standard of which then be represented in a portfolio. There is one more possibility. Most of the people who have had degrees in these health allied subject areas, they tend to first do PWP training, which is psychological well-being practitioners training. And in addition to that, they have work experience up to 2 years, post qualifications. This is in line with the National NHS Talking Therapies guidelines. And the candidate with that qualifications will then be able to apply NHS-funded places available for CBT training. Louise, shall I continue until the next slide? And then you could explain a little bit more differences between core professions and KSA, right? If I just, yeah, I think you could take over. Basically, core professions are stipulated very specifically in BABCP, which Louise will explain in a minute. If you don't have that, KSA is the possible options, which is documenting all your skills and which need to be gained over 2 years in relevant mental health context in workplace. We expect everyone who applying to this course having undergraduate degree in very exceptional circumstances, maybe having core professions, which then may be considered for this course as well. Okay, I'm handing over to Louise. We'll explain you further other characteristics and pay details, and then we're open to your questions.
Wonderful, thank you, Camden. So as we've already alluded to, there are essentially 2 professional background routes into this training. So either you would have a BABCP recognised core profession. So this is things like being a qualified mental health nurse, a registered social worker, an occupational therapist, things like that, for example. Or you meet the criteria to complete what the BABCP call a Knowledge, Skills and Attitudes, or KSA, portfolio, which shows that you meet a number of criteria, you've received training on a number of topics, which is considered equivalent to having one of those core professional qualifications. And you can find out a lot more about both of these options at the BABCP website, and we've got some links at the end of this slide show that you can follow to find out a lot more about these 2 different routes. But as we've mentioned, there's quite a lot of different professional backgrounds that could well be eligible. So on this slide, you can see some of the organisations or professional bodies that individuals may be affiliated with in preparation for coming onto a high intensity training course. So as I've mentioned, you've got Social Work England, you've got HCPC, the NMC, and for our colleagues who are psychological wellbeing practitioners or PWPs, they may well be accredited with organisations including BABCP. So moving on to think a little bit more about other characteristics that individuals might have that would make them very well placed for entering onto a training like this. So as you can see, this is a role where you're going to be working in a therapeutic capacity with patients. So there needs to be a real desire to do that type of work and to actually help individuals who are experiencing these kinds of difficulties. There also needs to be an ability, particularly during the training period, to manage quite a demanding workload and balancing the demands of clinical work and the requirements of the service that that person is working within, as well as all the academic study that is required within the actual qualification itself. As you've heard already, our professional organisation is BABCP, so the British Association of Behavioural and Cognitive Psychotherapists, and individuals need to fundamentally agree to abiding by the standards of conduct, performance and ethics of that organisation. And as we've mentioned already, there are some stipulations around how long somebody needs to have been qualified for if they've previously completed a qualified psychological therapies training, which was funded. There are rules around how long needs to have passed before they can begin another funded psychological therapy training, such as high intensity. So just a note as well on international students and international candidates. So typically roles for high intensity therapists are advertised through the NHS services which are looking to recruit those individuals. So typically that happens through NHS jobs and other sort of places that jobs like this get advertised. So individuals are absolutely welcome and encouraged to apply, even if they're based internationally at that point, but would need to demonstrate that they meet all of the entry requirements which we've mentioned. And where individuals do hold qualifications which have been awarded outside of the UK, there may need to be some demonstration of the equivalence of those qualifications in order to show that those entry requirements have been met. And ideally, some work experience, some clinical work experience within the UK is desirable and ideal, but as Camden mentioned earlier, that experience of working clinically in health settings is a requirement for everybody, regardless of where they might be based at the time of application. Moving on to the pay of this kind of role. So the pay bands align with the NHS Agenda for Change pay banding system, and typically a high intensity therapist is employed on a band 6 as a trainee, and upon qualification will move to a band 7. And I know it's quite small on the slide here, but you can see some examples of what the salary would be on those bands. And again, in a moment, we've got a slide with lots of links where you can find out more about these things. And here we are, this is the slide. So there's a few links here. A key one is the BOBCP website. You can find out lots and lots of information about the role and the training there. And there's also specific links to their list of eligible core professional backgrounds, the KSA information, the NHS Agenda for Change pay information, and then a link to a site which details more about this 2-year funding rule policy and which trainings that applies to. So that brings us to the end of our presentation. We hope that that's been helpful, and we'll be happy to answer questions at whatever stage that falls within the evening.
Thank you very much. That's really helpful. And I think there are some really good questions coming in the chat that we'll want to direct to you both when we come to the question section. Thank you very much indeed. That was really helpful. And now we're going to turn to Lynn. You're going to talk to us about your experience of being a trainee, aren't you?
Yes, I am. Thank you, Maggie. So I'm currently on the cognitive behavioral therapy, high intensity therapy training course, and I'm training with the University of East Anglia. What I'm going to just talk you through is what to kind of expect as a trainee, either within the university course. I'm currently employed by an NHS service, so what my day-to-day looks like in my week, and maybe some challenges that I'm seeing while I'm on the course as well, just to give you a bit of a flavour of what it's like. So I'm currently 2/3 way through the course at the moment. The course is about 12 months long, so this is semester number 2 now. We've started really getting into what the treatment protocols or the treatment interventions look like, which is really exciting because some of the stuff that I'm learning is really quite new to me, and I can't wait to make use of it, see how it works, and develop my skills as I go forwards. So my week, I'm full-time employed, so 3 of my days are in-service days where I'm working, having clinical contact with patients, and I also have face-to-face appointments, and I also work on video call services. The other 2 days of the week, I am doing my studies with uni, so I've got a full day, 9 till 5 of lectures on 2 days. But with the course that I'm on at the moment, there are blocks where I do have to actually come into the university and do face-to-face learning with the lecturers. And these blocks of teaching or learning are usually organized in like 4 days of the week. So I wind up having 1 day in service and 4 days of university. So far, I like that balance. I get a good mix, a good blend of face-to-face teaching and online learning. With the course, you get supervision. I don't know how many of you know what supervision is, but it's a space, a safe space where you can talk about how you're getting on with the patients that you're getting on, that you're working with, a space where you can talk about how you're getting on, applying what you're learning in university, so fusing that theoretical with the practical, and practicing the skills that you need to make it feel more seamless. At work, I also have a supervisor, and we meet once a week as well, and we talk about the same kind of things, but on different cases, how I'm fusing the theoretical knowledge with my practical knowledge. And I also get a chance to practice my skills so that I'm not just going into a meeting or an appointment with a patient and doing the technique first time round with the patients. I get space to practice with my supervisors. I also have a space at work where we've got a peer support group, where you can talk about the skills that I'm trying to develop and have a bit more of an extended session maybe on what I've learned from my supervisor and put that more into practice with my peer support. I'm finding that on the course I'm on right now, I've got a good camaraderie with the people that I'm on the course with. We're sharing resources, asking questions, which are really helpful in our learning, because it's not, you're not going to think of every problem or every question, but it helps to see that others are thinking about it. Ask a question that maybe you hadn't thought about. The course, as the name says, is high intensity therapy, but I'm finding that the course is also high intensity learning. You get X amount of time to get through the disorders that Gareth mentioned, learn about PTSD, social anxiety, depression, and the different ways in which to assess it, and then do the treatment. So there's going to be assessments that you need to submit, assignments that you need to submit to demonstrate that what you're learning at university is actually transferring into practical skills. And for that, it's really important to be doing some practice on yourself. So we call that self-practice, and reflection as well about, okay, so what am I going to do differently next time? I tried this and this is how it worked. Either I repeat or I do something different. So it's different to my previous roles, but with the support that I'm getting on the course at the moment and the support that I'm getting from my supervisors and my managers at work, this feels like something that is manageable, even though it feels like it's high intensity course at the moment. What I'm learning for myself through this course is it's important to be open to trying out the techniques that I intend to share and offer in treatment with the people that I'm going to be treating, because that experience of knowing how it feels, how it works, or the different steps and the stumbling blocks that someone might come across could be really informative in how you then share that with someone that you will be working with. So I really value that space that we get on the training course and the space to be able to do that in supervision. Maggie, I think I'm done.
I think that was lovely, and I think your enthusiasm really came through, and you gave a super flavour of what it's like to be a trainee. So thank you very much for that. That was really great, and I'm sure there'll be some questions for you as well. So I'm just going to share my screen again. There we go. So I guess for all of our presenters, it's now a chance to think about some of these questions together. So it would be really helpful to just think a little bit about what people were doing before their training. So I don't know if you want to talk a little bit about that, Lynn, and then maybe Gareth might say something, and then our course representatives might share a typical experience.
Yes, sure, Maggie. So before I came in to do the training as a high intensity therapist, I had worked as a psychological wellbeing practitioner, or PWP. I had done that for 3-4 years while I was just making sure that I'm happy to go on to the next step, that the next step really was what I wanted to do. So I'm coming onto this level knowing that this is what I'm deciding on doing. Before even coming into talking therapies, I had a psychology degree and I did some years of teaching in secondary school.
Thank you. Gareth, would you like to say something about your routes into becoming a trainee and then qualified?
Yes. Sorry, pardon me. Yeah, so in my case, prior to training as a therapist, I taught and helped people with special needs to manage different forms of anxiety. That I found that especially rewarding, and that inspired me to retrain as a therapist. And in terms of my training, I went down the KSA and postgraduate diploma pathway.
Thank you very much. That's really helpful. Louise and Camden, do you have any reflections to contribute to this?
I'll just chip in just to add that I personally came from a similar background to Lynn in terms of I'd studied psychology. I then was a PWP for a period of time and then progressed on to high intensity myself, minus the teaching in schools that you did, Lynn. But actually, on our course and sort of courses around the country, what we find is that there is quite a wide range of professional backgrounds that people do come from, and often we do have a sort of fair proportion on most cohorts of individuals who have been PWPs and have worked in NHS talking therapy settings already. But then we have lots of other people who've either worked in healthcare settings, in different roles, but then sometimes completely outside of healthcare settings as well. So it really is quite a wide range. And like we said earlier, so long as the sort of core entry requirements are met, we're really happy to have a wide range of professional backgrounds. And in fact, I know that's one of the directions of the NHS Talking Therapies programme, that we want to sort of increase the diversity of the workforce in that way.
Yeah. If I may come at that point, I would say it's very similar experiences we have in our cohort. I myself had a long history. Unfortunately, it's not a very good example because like two of you, I'm also from psychology background, but I work as an academic so many years before I step into practicing, which is, people go shift from one direction to another, not always from practice to academia, but from also academia to practice if they see fit. And that was perfectly okay. It was a very fast learning curve, Lynn. I totally agree with you. But it's so invigorating and so sort of engaging. In terms of the course in your art, Richard, and I'm sure other places as well, we have diverse teaching team who has got many different backgrounds, varied from social work to psychiatry, as a matter of fact, but also student body equally diverse. Like yourself, Louise, we have significant number of the funded students are coming from a PW background, but also funded students who have different background, like social work, like nursing, mental health, nursing, and others. So it is quite common to come from a different background. As long as you feel like this is the right space for you, you would like to make contribution, it is then you're in the right track to make that decision, I would say.
Thank you, Maggie. Sorry, was someone speaking then? Okay, thank you. It would be really good to get your thoughts on what are the qualities and skills that make for a really good CBT therapist or somebody who does well in the training. What are the things that stand out?
You start, Louise.
Shall I start? Okay.
Yeah.
So I think for me there's two sides to this. There's the sort of like organizational and kind of ability to manage workload type skills for the training in particular. And I think, like you can probably see all of us alluding to, this is a really demanding training. It's fast paced, it's high intensity by name, high intensity by nature, and it's students who tend to do well have an ability to manage the demands of all that, to be organised with their workload, to plan for when assignments and other kinds of work are due, so really to sort of manage the practicalities of all that. But I think on the sort of more kind of therapeutic skills side of things, and part of what we look for in our recruitment processes is, do individuals have those core therapeutic skills or the ability to sort of show that they can work well with individuals in that therapeutic sense. We don't expect people to be kind of fully formed therapists at that point, but to show the potential and those core skills of working with individuals.
If I may take now, and I would certainly second everything Louise said. Organization, especially if you're doing full-time, is extremely important. You're working full-time in a way and studying full-time. It's just that your time is divided between two spaces. And you need to sort of, in a way, doing this degree whilst you're doing your practice in NHS Trust is a great preparations to your future job, because that's going to be still quite demanding, still high intense. So doing the training is prepare you what kinds of work you may be doing within NHS. In addition to everything else Louise said, having to time management, passion, and certain personal skills, which partly you develop during the training, but the others is you perhaps also you feel like you're right person for this kinds of space. I think the one other thing I will add is the compassion and wanted to help people, and not necessarily helping holding hands, but being in that space, walking hand by hand to provide that extra bit of support that person needs to help themselves. For that respect, I think compassion of helping others, in my view, is quite important. If you have those qualities, we would say certainly consider it, and you're more than welcome to one of our courses.
Excellent points, thank you. And I'm going to invite Gareth and Lynn to see if they would like to add to that list.
I completely agree with what Louise and Candace mentioned about being well organised, having that desire to help people, and I think for me that as well, that kind of that enthusiasm to continue to engage in continuous professional development. It's yeah, it's something that I personally love doing, and I think it's key to the role, regardless of who we are or how long we've been working in the profession for.
That's a good point.
And I haven't finished the course yet, but I'm seeing myself feeling more proactive about what I need and using the support networks that I know are available to me. So I think being able to identify your support networks, being proactive about what your needs are and speaking them out or verbalizing them will potentially put you in good stead alongside everything Candan, Louise and Gareth have mentioned. Anything else, I guess it will be up to how the chips were going to fall, really. But we've got some good advice.
I'm just wondering whether you'd be able to say, kind of in a sentence, what advice you would give to somebody who's thinking about going into the training. Is there anything that jumps to your mind or anything that you wish that you'd known beforehand?
I think for me, it's the depth to how much you need to be willing to go and look for things inside yourself sometimes. Because if you're practicing of the protocols or the techniques, there is stuff that might come out that you didn't know about yourself. So being prepared that you're going to learn some surprising things about your own mental health or your own well-being or your own experiences, and being prepared to do that and know what to do with that kind of stuff, maybe having a support network maybe at home, that you can turn to if things have felt quite real for you when you're doing your practice of the techniques. That's one thing that jumps out at me. Be prepared to be real with yourself.
That's very insightful and helpful. Thank you. Did anybody have anything that they wanted to add to that, or shall we start thinking about some of the questions in the chat?
I think for me, looking back at my training, it was challenging at times, completing the course of study and a placement, and also managing other commitments. But having said that, it was and continues to be incredibly rewarding when I help a patient, when I discharge a patient, and they thankfully feel better. It's such an amazing feeling. So it's a challenging course of study and a challenging profession, but extremely enjoyable and rewarding.
And I think you've conveyed that really beautifully. Thank you, Gareth. So I'm just going to pull out a couple of questions because they've jumped out at me around kind of practicalities. So how long is the course? When can the courses be accessed? Where can they find information about courses? What can you tell us?
Shall I jump in with some information on those things, and feel free to join me, Camden?
Yes, please, Louise.
So the length of the course will likely vary depending upon what academic qualification you're aiming to end up with. So the postgraduate diploma that we offer at UEA it typically runs over just over an academic year. So the teaching is delivered across 3 semesters, and then because there's quite a number of assignments, those sometimes just take the course slightly over the year. And we and any university offering this type of course will generally have a sort of standard intake each year, sometimes more than one intake each year. So the roles are often advertised through NHS services to align with that. So, for example, we have a September start cohort and often a March start cohort as well. And so the sort of adverts for those roles go out via the NHS services that I mentioned earlier, sort of a number of months ahead of that, in order for the recruitment processes to happen in time for individuals to then give their notice and things like that from previous roles and be ready to start when the university intakes begin. And often services like successful candidates to maybe start in the role even a little before the course begins, so that they can get inducted into the service and the role and things like that. I've forgotten the last part, Maggie. And Camden, perhaps you want to add anything?
Oh, you're on mute.
Thank you. Wrong time. As we said, is if you're coming with the NHS trust funding route, it's usually full-time, although part-time options has been considered, not been in place yet. So that means you apply to NHS funding through NHS England, and perhaps also very specific talking therapies unit. And those applications then being reviewed and shortlisted by the trust, and then organizations like ours, universities, involved afterwards during the final selection stage in interviews. So there's an interview process. As Luis said, each university has got slightly different structure, and if they have existing part-time route, which some of them are, like the one I'm representing here, is then you organize your placement. It could be NHS or otherwise, but need to be being audited. And then you fulfill all the criteria, which are not different than NHS Trust, just that maybe it's all been organized by you, and you can then do it part-time over 2 years. Typical full-time training is 12 months, September to September or March to March, I would imagine, Luis. If it is part-time, you double this space for it. We are talking about PG DIP when we say that. PG DIPs are 12 months. There are lots to fit in, and there are lots of BABCP requirement, and hence the portfolios need to be completed. If you decided to do a top up to masters, that means a further 60 credit, which usually taking the following years, even if you are doing full time.
Thank you very much. I'm just going to ask Emily and Fumi from the PPN whether you've identified any particular questions that are standing out as popular. You may not have had a chance to. I'm going to just jump in here because we've had quite a lot of questions from people who are in undergraduate degrees, and I guess they're coming to the end of their degree and they're wondering what to do next. I wonder if you have any thoughts about where they could be looking.
Well, if you don't mind, Liz, this time I just come in, and I'm sure you have more to add on. I would say if you are passionate about working with the in therapies and would like to learn skills towards helping others in this particular context for early interventions for depression, anxiety, start working in, well, you could, ideally, I would recommend you to start working now in charities and organizations that you will gain experience, and you can be a bit flexible as well. You can try different places to see where you fit best, where you're getting the most satisfaction out of. Age groups, different presentations. Utilize all these opportunities starting from, I would say, year 2, probably year 3 will be too busy with your all other demands. And eventually when you finish, I would still suggest 2 possibilities. Having some experience working in charities like Mind, like Samaritans, and similar mental health context charities, and apply initially PW roles. And once you've done that, move on to CBT is one traditional and most followed route. And it gives you more confidence because you build your skills step by step. First, more behavioral interventions. Second of all, more combined cognitive and behavioral skills. And each of which has worked slightly different modalities, yet in the same space. Early intervention services. I think that is the best way, easy way in, and also building up your skills as you go along. There are people who already working, has got core professions, already have skills, as a different story, of course, which I don't think we're talking about them. Very rarely people go to directly CBT training without PWP, but that's possible if you feel like you have done enough in mental health settings. Yes, that's also an option. And roles, I didn't name the roles. Louise might name them. There are numerous number of roles within NHS or in charities. May not necessarily therapeutic directly, but it's aiding, guiding, and helping roles, which will help you through build up your skills through observation initially, and then by practicing. That's all from me for now.
Louise, did you want to come in and say something?
I think just very briefly to second what Candan said, I think if you are coming towards the end of your degree and thinking, oh, how can I begin building up this experience? I think look at any kind of role which enables you to work with people in a sort of helping capacity. It may not be a sort of necessarily a therapeutic way specifically at that point, but something where you are beginning to gain experience of working with people in a helping capacity, and that could be in lots of different settings, in lots of different roles. And you may start off, or you may move on to looking at roles like assistant psychologist roles or other professional trainings like PWP or others. But I think, yeah, just looking at different ways that you can start building up that experience of working directly with individuals.
Thank you, Louise. And I think that's a good point. So very shortly, we're going to show a slide because I'm aware that we're coming to the end of the time we have available. But actually, our colleagues in the Southwest Psychological Professions Network are having an event that's coming up shortly, which focuses on the practitioner roles. And the practitioner roles are the funded roles that people typically train in before they come on to become a CBT therapist or before they're going into the training. So I would suggest that anybody here who's thinking about doing a training so that they can then come on to this CBT therapist training goes to the Southwest event and finds out more about the psychological practitioner roles. Okay, so it's clear to me that we're not going to get all of our questions answered by any stretch of the imagination in the time. So what we'll do is take these questions away, produce some answers for them, and make those available on the website so that the questions will get answered. They're really great and valuable questions. Thank you for asking them. We will make sure that they get answered. I'm going to share my screen again. Okay, so the recordings of this meeting and other meetings are available on the PPN website. I saw a question in the chat about making really strong applications for jobs and how to do well at interview. So we've had sessions on both of those things with some really great tips and hints on how to do well at application forms, how to do well at interviews, please go and look at those recordings on the website. They're all available. Information about all of the careers in the psychological professions. So you can see on the left-hand side, the psychological practitioners' roles, the CBT therapist high intensity role is here in the middle, and then the roles for psychologists are on the right-hand side. Do have a look on the PPN website and find out these careers. You can click on these different clouds and you can find out about them in more detail. We're going to put a link to the feedback survey in the chat. Please do take the time to tell us what you think about today and what we could do to improve it. We really value your feedback. Please do. The next Aspiring Psychological Professions meeting is on Tuesday, the 26th of March. We have the topic still to be confirmed, but we'll email that out to you and let you know. This is the event on psychological practitioners that our colleagues in the Southwest are doing. So it's on Friday, the 15th of March. It's online. It's 10 o'clock to 12 o'clock. Have you thought about becoming a psychological practitioner? And they're going to be covering the experiences needed, training, what the day-to-day role is like. And those are the roles at the top. Do join the PPN. It's entirely free. It's really quick to join. We would really encourage you to do that. Click on the box which says that you want to belong to the East of England, and then you can find out all about the different things that we're doing. It really helps you develop your career and stay in touch with the psychological professions. And as I said, it's entirely free. We have some resources that we'll make available to you on the website. I think that's everything that we want to say at this time, apart from thank you very much for our absolutely fantastic speakers who've given up their time this evening and the information that they've shared with us. Thank you very much indeed. I think we're going to close there. Thank you very much. Thank you, Lynn. Thank you, Louise and Candan. Thank you, Gareth. Thank you.